You are seeing my screen, I hope, and I can hopefully
Yes.
engage in the slides like so. All right, welcome everybody. Um, so we're going to go to doing and modeling business today. So I'm going to talk about business model, but it is not the only thing I'm going to talk about because I have a hard time discussing business model for an hour without stepping into other areas. So I'm going to do a lot of different things today and cover a lot of ground. And hopefully you will have some takeaways that are useful, and I'll be happy to discuss anything with you guys further on. So let's dive into it. So the first thing I want to do is to tell you where I come from, what I've done, basically because I have been in your situation a number of times and I always wondered, like, this guy presenting now, what the hell is he talking about? Does he even know what's up and down on this? And has he even been there? So what is his experience and what is his qualifications to have opinions about anything? So in order to just take that up front, I want to make sure that you understand where my opinions come from and what kind of experience I have to bring to the table here. So I have a developer background, and this is dates back in the 90s, like the last millennium. I'm that old. I've been active in healthcare since 1997, where I did my first clinical database for heart failure in Denmark, and I kind of made a big an entree on the stage of healthcare IT nationally in Denmark when I was awarded the opportunity to build and design the principles and the components behind the national Danish healthcare portal, which was launched in 2003, which will have a 20-year anniversary next year. That's how long it's been operational. So it indicates a little bit about how far ahead of the curve Denmark really is in terms of IT and healthcare IT. And this platform is probably most integrated and well-developed national healthcare go-to platform for everybody, including clinicians in Denmark. And it has more than 205 unique users each month in a country with 5.5 million. It's integrated to more than 160 systems and has every single piece of medical information you can imagine available, including your prescriptions, where you've done, what you've been, your lab results, anything you can imagine. After that, I went into consultancy, became like the expert of healthcare IT in Denmark, and worked as expert in medical records, and joined a number of national projects on infrastructure, and had the opportunity to build and deliver the first version of the national service platform in 2011 to Denmark, which was basically the beginning of the nervous system that connect every single healthcare IT system in the country to make sure that all the data that goes back and forth between each services are totally standardized and consolidated, so the same people have the same data at the same time for much less reduced costs, which has a huge impact on standardization and the ease of communication between different entities in the system, connecting the GPs, the general practitioners, the doctors, with the municipal governments, with the regional governments, with the national government, and the central registers and databases, in order to make a coherent system that eases transportation of data and integration in a secure way between all the actors. So being consultant for a lot of years, I finally decided that building the best healthcare system in the world and putting it online was like a good start. So what was the missing link? The missing link was telehealth, because having the best IT system in the world doesn't mean dick if you don't have access to people. And people are at home. They don't want to go to the hospitals. It's just bloody dangerous. You're going to die in the hospital. So people don't want to go to the hospital. So how do you bring the healthcare system to the people? And this is the missing link. So I worked into the telehealth business in 2012 and launched a platform in 2013, which was funded by the government as an open source project. So I had the opportunity to build that for the government and launched an open source project to telehealth in 2013, and went large scale because they wanted to prove that large scale telehealth implementation had a good ROI, and have done that since 2013. Didn't lose any clients because everybody likes telehealth, but most importantly, we also proved that we could save up to 15 euros per day per patient in a clinical trial of this. So my background is national healthcare IT, and 8-9 years now in the virtual care business. So I hope you will appreciate that I may be opinionated, but I do have a little bit of experience to build on. And now for me, let's go into this. So you're going to do a business model canvas. So this is kind of your homework. So, and I think the business model canvas is very, very good for defining what you actually think your business is. And the good part of it is that you're probably going to find out that isn't quite entirely what you thought it was. So this is primarily an educational tool for you to get closer and get wiser to what it is. But it is also an iteration of stuff that you already know. So this is primarily a communication tool for you to communicate to your peers and to your investors and to your colleagues what this business is about. Hopefully, you will not be in doubt when the day know that at that point in time we're in deep trouble. So if you are doing the big business model canvas, try to be very, very precise and very, very specific. It's really, really short, very content-loaded sentences. Don't use the consultancy, blah, 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 but be very precise. The more precise you are, the better the reader can see what you're looking at. And of course, don't try to go deep. Present the tip of the iceberg, well knowing that underneath each topic, there is a mountain of stuff that needs to be done and needs to work before you can sort of present the statements. So try to present the tip of the iceberg. Don't go too deep, because then people will get confused. And you often get lost in details about stuff that really excites you. So hopefully your business excites you, but try to be concise. And this is not just the business model canvas; it's everywhere. I often meet people who are very much into the product, about my product does this, my product does that, and I'm so excited. It's really fantastic. But what you really want to talk about is what you can do with your product, and not your product itself. But not in business model canvas. The business model canvas is about how to make your products and what it's all about. So if you can use the BMC to anything constructive, it would be probably to identify a single point of failure and a bottleneck that you probably have. The most startups don't plan and have funding to do complete redundancy of critical stuff. So if you can identify a single point of failures or bottlenecks, then you should probably plan for a workaround redundancy. And one of these examples could be you are using Amazon Web Services for building your cloud system. And Amazon Web Services are great. They make things go really fast, and you can really use it to jump forward fast. But the problem is that most of the people in the healthcare space will want to have their installation on premise, because they do not want personal identifiable information to be present on an Amazon Web Service. So they will tell you, yeah, that's nice, you have a great system, but if it doesn't run on my private cloud in the basement of my hospital, then you can forget it. So that's kind of like a bottleneck failure. You need to plan around having the ability to install on something that isn't Amazon or Azure or Google Cloud. And that's a bit of a problem, because then you can't take advantage of all the tools they have, and so on and so forth. So that's just one example. So see if you have single points of failures or bottlenecks that shows up when you do your BMC, then, well, plan for a workaround, because at some point someone will ask you the question that really hurts. So what are you going to do if you can't do that? Yeah, and that's a good rule. What are you going to do if you can't do that? That's a good rule. Try to put that in mind. Always ask for plan B. Always have a plan B. So get your target straight. Aim for what you can hit. It's nice to have visions. It's nice to have a product that has a broad vision and a very powerful message. But in your business, you need to have a credible target that people believe you can hit. And I think we also have the issue about when you present to the investors, like the hockey stick, like you go like this, then you invest, then wow, it takes off like a rocket, that you have, then you're billionaires. And everybody expects to see a hockey stick. But I think if you really want to be credible, then find out and try to scope your target, and try to scope your business and your growth and your aims in a way that you are credible, which is probably means that aim for a pilot, and then an incremental increase, and then maybe if you're really conservative, then a logarithmic increase later at the point. But trying to stay out of the exponential numbers, because they always cheat, and you always forgot to take into account that whatever you do in the healthcare space, it always takes more time than in everybody else's businesses. So to actually do your BMC, from you start describing it, it's probably a couple of years, and what you really need to do with your business, not just the BMC, is to cross the chasm, which is basically to get from the pilot and the validation into something somebody wants to take it in production and start having some real references that you can move across. So the BMC can help get you there by identifying weak points, but it is a description tool, and it's only the top of the iceberg. So it will use it as a communication tool and make sure that it's correct, because people want to see it. but don't expect that anyone will come and pat you on the back and say, oh, what a fantastic business, I'm going to invest, just because of the business model. But make one and shoot it over and try to focus on the short, concise statements and use it to your own advantage by trying to identify bottlenecks. Okay, so just for the sake of it, I've tried to do a business model canvas on my own business, and I've tried to be very, very precise. And this is my take on what people want to know in this business model canvas. But you can see it in the slides afterwards. So yeah. One example, I think, yeah. Let's take an example, the customer relationships. What kind of channels do you have? Do you have pre-sale? Do you have onboarding? Do you have support? Do you have bespoke services? Do you have license sale? How do you communicate? Don't go into details about which kind of mail address they use and stuff like that, but make sure that you have the channels in place. So yeah, not too much about that. So what you probably want to do at some point is to enter the EU market. And there's a number of things you want to do here before you can go so far as to build a business. So what I would suggest, if you haven't done already, and you have because you're already here, use the accelerators. There are so many, and they are very, very good, some of them better than others, but get your value proposition in shape. Find out what is it really that I have that brings value to anyone. And you may think you have it until somebody a bit more experienced and smarter than you sits down in front of you and say, so what about this and this and this? And then you go, oh my God, I didn't have that. I didn't think about that. And then suddenly your value proposition will change. You probably change 3 or 4 times. Mine did anyway, before you kind of nail it. And go back to it. If things change around you, your value proposition may change. Like when the pandemic struck, a lot of value propositions suddenly changed because the surrounding conditions for what kind of value you could bring changed radically. So if you think your value proposition changes because of surrounding areas like the pandemic, well, reevaluate it. It's not like set in stone, but make sure that you spend a lot of time discussing this with people outside of your own organizations to get their take on it. So you would be surprised that people that come from other parts of the same business have completely different perceptions of what kind of value you can bring and how it affects them and how it can affect the healthcare system and the people in the healthcare system. So in order for that to work on it and be open-minded, you may not like everything you hear, but try to be open-minded, but input and find the right point of view that you can get on board and that you think is the right one. And then for God's sake, practice pitching. Go to all the pitching contests you can, because they will put you on the spot. You will be in the lifeline. You'll be in front of the firing squad. You will be on stage, and they will have the pressure, and you will feel the sweat on the sweat beating on your forehead. And this is really, really good, because when people are under pressure, the most amazing things come out. You know, you start saying things you didn't even know you had in you, just because you're under pressure. And this is something that you want to do, because it kind of removes all the decorations of everything and brings to the core of you and your product and your value proposition to the stage. So in order for you to make it in this, you need to be very, very good and very confident in pitching. So you need to practice it. And this is basically it. And I think you have to take a note that a good pitch deck for 5 minutes speed pitch will take you 90 hours to build. 90 hours. If you spend less than that, then it's not good enough. And this is in a general opinion. I didn't do this, invent this myself. I was told by a very, very experienced pitch doctor that this was the average number of hours used in a good pitch deck. So do that, do it a lot. And at the same time, yeah, build the network. I think the pandemic was really crap for us networkers, because we can't go and build network. But many, if not all of the pitching competitions and the accelerator events, they have networking events as a part of their setup. So it works really well to go there and meet people and speed date and exchange information and knowledge with other guys. If they do not bring you business, they bring you network. And everybody in your situation also realize that you guys need to stick together and help each other out. And they can only help you out if they understand what the hell you're doing. So try to build networking speed date and make sure that all your peers know what you're doing, even though if they don't, because if they see an opportunity that might bring advantage to you, they might just help you and pitch that opportunity to you if they know you're there. If they don't know you're there, trust me, nothing is going to happen. So speed date, meet people, go to conferences. I'm the MedTech Forum in Barcelona today. It's mostly a networking event for me. Go there, go to the HIMSS, go to the MedTech, go to the DEMEA in Berlin, and talk to people, meet people, and ask them what they have and tell them what you got, and be out there. And network is really, really important. So in terms of market evaluation, before you go to market, any market, you need to find out that this is actually the right market for you. So you need to be a little bit step a little bit back from your geography and your native place of business, and look at the size of your market. Like I was in Denmark, and my market was 5.5 million people, which is nothing. So Denmark obviously wasn't my go-to market. Of course, I was there already, but I did not have to invest in that. So where did my investment go? It went to another market. So look at the size of the market before you spend, because you don't have a lot of money to spend on going to market. So you want to spend them where it matters. So have a process that you can show to the investors and say, I did this evaluation, and this is my go-to market. So one of the things you want to look at is also IT maturity, infrastructure. Do they have the necessary bandwidth in infrastructure? Do they have smartphones? Well, everybody has mostly, but some don't. Some have rules and regulatory issues that will be really big complication. Some will have easy regulatory things that you can easily get around. If you build a hardware device, you need to register it. If you build a software device, there's like the MDR and all kinds of stuff. But make sure you get a good look at the regulatory complexity. I was considering going to Korea with myself at some point, and turned out there was actually an active regulatory barrier, because it was simply forbidden by law to do anything related to telehealth and remote patient monitoring. So I kind of it didn't kind of work out. But also in the European markets, one of the most attractive market in the European setup is obviously the big ones like Germany and France. France, they have their own things, but basically they are moving fast towards technology implementation and utilization. But in Germany, the regulatory complexity and the basic setup is really, really tough, because the national inherent aversion towards IT and databases is really, really difficult to work around. So you need to be very careful about getting into the German market, because you need to find out what will be the barriers on the regulatory area. So you need to study that before you invest heavily and go into the German market. It's also very complicated, but that's another thing. So do that, and of course make some kind of assessment. And if you are in a market already, it may not be the biggest market, but if you already have clients in a neighboring country, maybe that's a good idea to go there, because it's easy and you can save money. But try to make a weighted evaluation of these different parameters when you go, in order to make sure that you choose the right ones. For me, when I went to Nordics, I went to UK, and I went to Canada, because they seemed to be the same. But as it turned out, Canada didn't have any kind of reimbursement for what I did. So reimbursement was not present. So that basically means that nobody will sell your service, because they will not get reimbursed. So that's a dead end. So probably get your business case in order and get proof of value, which means that first of all, you need to decide, is there a reimbursement that is available for me? Can people make money doing what I have, using what I have? If that is not the case, then that's not your market. So you have to be very certain about that, to make sure the reimbursement structure are in place. The US is pretty simple, because there are a number of reimbursement directives that gives a very clear indication of what is reimbursable and what is not from the government point of view. But once you has certified the fact that you can get, or someone can make money, you can, or your partners can make money on selling the stuff you got, find someone who can test it out for you and get the proof of value. You may of course want to do a clinical trial on that, but barring that, the next best thing, and actually the most important thing, is to get someone to buy it and use it and get proof that it works. So you may want to give it away for free or sell it at a very, very low rate or whatever you want to do. But your first order of gender is to get proof of value, because this is going to drive evaluation. This is going to interest investors because it's real world feedback. And there's nothing that beats real world feedback. You can talk and you can wave your arms all you want, but if you have proof of value, that's going to get people's attention. So get there. Yeah, and another thing about going back to the pitching a little bit here, pitch sales material. I have done a video which is well produced and has a good message and a good cadence. It's a bit long for pitch. It's 10 minutes long, but it's an example of the kind of videos and the quality you want to go with when you want to make a good impression. And take into account when you watch these 10 minutes that this took more than 1 day to produce. So everything good comes with a price tag. Invest in your pitching and you invest in your skills and your capabilities, and assuming that you suck, because most people do. You may think yourself to be a decent presenter and so on, but basically that's not good enough. You need to set the bar high and really work to improve, which means that take videos, review yourself, take videos again, have others reviewing it, find out where your strengths are, where your weaknesses are, and work on those. I usually say that it's a long journey to break through the barrier of being happy to perform, but you need to be a performer. You need to be happy for the limelight and for the attention. If you are introvert, this needs a lot more work than if you're not. And if you're an extrovert, then study body language. I usually say, look at the TED talk called Fake It Until You Become It, which is a kind of like a mental attitude towards being more than you are and just eventually becoming more than you are, which is good attitude. So work to improve hard, and make no mistake, this is a do or die moment for startups. So if your English isn't great, make a script and practice fluent performance, record it. Don't worry about accents. The accents don't count. I think the only thing that counts is being fluent and having a message. And don't do like I do. Don't talk too fast because you lose people. It's better to take pauses. And I think one of my favorite speakers is the former President Obama. He had this way of making pauses into a speech that really got the punchline through. Like he really got people thinking. And that's very powerful. So there are tools in making presentation pitches that does not include saying anything, which is quite interesting. So try to study that and use it and find your own style, because everybody has their own style. You cannot do anyone else's. And if you don't think you've got enough wattage to burn through, use humor. It's always important to break the ice with something that is not the topic. So when you do a presentation, don't dive into the hardcore stuff right away. Start by saying, hey, let's have it. I would like to propose a toast for everybody's health. And do know this joke about the doctor. Do know what is the difference between the God and a doctor? And yeah, of course, the answer is that God knows it's not a doctor. Ha ha ha. I crack that every single time, and it always gets people smiling, even if they know it, because it's so good for the healthcare business, because everybody knows that doctors can be very difficult to work. So try to use that kind of tag, apply humor and use that. And as I said, the body language, fake it, cheat, whatever you need to do, but make sure you study body language, because I have seen so many guys and girls turn their backs on the audience to look at the slides. I have seen so many guys look down the floor and the feet and put their arms in the pockets or hands in the pockets. So find out what to do with your arms, move around on the stage, wave your arms, change your intonation, speak fast, speak slow, make breaks, change tempo, keep people on their feet, and study body language again, because it sounds stupid, but it's so really important. You wouldn't believe it. And of course, when you go on stage, it's going to be difficult, because you always got these like butterflies in the stomach, and you will, trust me, even after 20 years, I still have them, and it's good because they make you better. But the thing is this: if you are very confident in your opening statements, and you can do it in your sleep, the first 20 seconds, nail that, because if you have that, you will nail the rest of the presentation, because the trick is to get going. And once you get going, then you have the rest on repeat. But the start is where everybody stumble. So spend a lot of effort on the opening statements and really, really practice it so you're happy with it. That will help you a lot. Yeah, well, don't ever stop looking for ways to improve your performance. There's always some ways to improve your performance. There's always some way to make your communication better. Always try to find out who is my audience today and what does my audience think about this and that, and then try to bend your style and your performance towards the audience. Like if you have doctors in the audience, you probably shouldn't crack the doctor joke and stuff like that. But you can always qualify your presentation by knowing more about the people there than not. And maybe probably the most important message: your brilliant product will not dazzle anyone by itself. It's a big mistake to think that this is so. Especially the Americans are very difficult to impress. And coming from Denmark, there's a lot of introverts that think that just being brilliant and being Danish is all it takes. So they go like, they maybe invented the cold fusion, and they go on stage and say, yeah, we did this amazing thing, and it was really cool. And yeah, it was good enough anyway. So this kind of underdog attitude doesn't get you anywhere. If you have a brilliant product, find out how to dazzle people with the product by presenting it in a way that people say, oh wow, this is really cool. Get the wow factor into your pitch, and build up for it. So it's kind of like staging. So it's kind of a story and a narrative. So find your way to tell about that. Okay. So you probably also got some kind of medical device regulatory consideration, and I'm not going to spend a lot of time on this, but I just want to tell you a few points that are important. You need to start assessing your quality management system early and looking into what will it take to go where I need to go in order to get the necessary regulatory compliance issues in place. Quality management is not something you do. It is something you live. You don't have it, you don't do it, you don't work with it, you live it. The quality management system is your business. Your business is the quality management system. There has to be 100% overlap between what you develop and do and how we work, and the documentation and the quality management of your company. If you don't have this attitude, then the quality management system will be something you are buttoning onto your business on the outside, which means you basically have to build the product and to build the quality management and keep it updated will give you so much headache that eventually you will die. This is not for fun. I really mean it. You need to engage with your development teams and your way you work and sell and document, and to make sure that you put everything in quality management system and document. This is not the business, the banking business. This is the healthcare business, and you will need it. And every single piece of information you put down increases the value of your company. Whenever somebody makes a due diligence on you, they find that you actually document stuff, they say, "Oh wow, this is cool. We didn't expect that." So find out what you need to do to get the quality management system in place and cover the ISO certification. If you need the ISO 1345, find out what the gap is and how to do it, and change whatever you do to cover the gap so that you are working in accordance with the needs of documentation in the ISO system. It's not that difficult. If you work with Jira already, you can add a few more tools and then change the way you document, and you should be well on your way. It's not imperative outside of the EU, but it's in the EU and the USA, you cannot go to the market with a medical device unless you start with the ISO certification and doing the QMS. So try to put everything you do into the QMS, because you need to document everything you do from the inception of the idea of the change in your product to the actual implementation of that change in your product needs to be documented without any kind of doubt from the start to the finish line. And then following up on the product, you need to document that as well. So it's not trivial, but it's not impossible either. Tools like Zendesk, Jira, Confluence, GitHub, Splunk, and so on gives a lot of documentation. There are tools out there that will help you get there. Yeah, then the CE mark, the class 2A MDR or FDA 510K is preferable, but clinical validation is the first step. It will bring you a long way. And after you have done that, you can use that probably to create the clinical evaluation report that you need in your certification efforts by both the FDA and the notified bodies in the EU. But it is more than that. It's a killer sales tool. You need to get it because actual clinical evidence knock people down every time. When you can say, put someone on the table says, this is not for discussion because here's the proof, bang, and then put the clinical evaluation report and the clinical trial on the table, then people shuts up and start listening. That's a killer sales tool. So start with the evaluation of the product and get your product tested and tried by someone in the real life, and then see if you can turn it into a clinical evaluation report or a clinical trial, even if you have the hospital on board with that. So make a note that every product and every project you do should, per definition, generate clinical evidence, and which means basically that when you do something, try to set it up as a double blind and get someone to write a report afterwards, because that's evidence, and evidence builds up towards the notified body's audit around the CE mark, and you will need it in order to pass the audit for the medical approval for the CE mark first, and then go back to the CE mark. But in any case, you need the ISO certificate. So plan for that, and plan for costs that you haven't been expecting on the notified bodies and the certification projects, because one thing is to pay for the quality manager to do this, which is a big post in itself, but it's also quite a post on the budget to get the regulatory compliance into place. And this is a surprising big cost. So try to get that nailed and budget for it. And also, when you do changes in your product, after having done the quality management and the ISO certification, you need to have to calculate that you will probably spend 2 to 3 times as many hours per change that you did before, because the documentation and the way you work in the quality management setup is extremely time consuming and not as agile as one would think, because you have to do a lot of work each time you make a release, and so you don't want to do that too often. Yeah, let's move on. So going back to the market evaluation, just to spend a few more time on the market evaluation. The primary indicators here are, of course, the market size, and I got that. And then you have the IT maturity about the infrastructure. I think it's important that you have the infrastructure in place. If you have ridiculous demands on security or availability to data, that's a good thing to know, especially in countries like Germany, where the regulatory complexity makes the IT infrastructure really, really complicated. And in the business case, this is where it gets exciting. This is where you want to know, what are my drivers here? What can I build? So what will be my cost of delivery? What do I have that can make me able to deliver the last mile? So how do I get my device into the hands of people? How do I get my software into the hands of people who are going to give it to them, who are going to maintain it, who are going to check it and support it and reclaim it and clean it and redeploy it in whichever geography, whichever country, whichever village in the country that you're going to do. So the last mile is something that people tend to overlook, and it's a huge barrier. So you need to find out what is the cost of delivery, and once you've done that, then you can start to looking at how much does it cost to get a client even. So if I have a hospital in the Netherlands that are my primary go-to hospital, what will it cost for me to bring that client into the fold and get him to sign the contract? What money do I need to spend to get there? How much time do I need to spend to get there? And it would be a good assumption that hospitals usually are not buying anything unless you have gone through a 12 to 18 month sales cycle. So that's a public hospital. Private hospitals are much faster. So try to look at the market and say, okay, what do I need? I need someone that does healthcare. Okay, where do they do healthcare? Yeah, they do it in the public space, which is you typically go to market because they are big and the money is big and the funding is there, and they do big scale, but they're also the slowest ones on the block. So they will never get anywhere. And definitely do not try to go to the government, because anyone who's trying to sell to the government will come up short. I have been in this business for more than 20 years. I have never sold anything directly to the government. It's always someone else buying it. So find out what is needed to get your client to sign the contract. What is the cost of that? You need to put that into your pipeline and your expectations, because if you are too aggressive on your expectations about how fast you can sell and how much you can sell, this is going to bite you in the butt. So the time to market is important, and this is also hugely depending on where you go with your product. Is this a consumer product? Are you marketing directly to people on the internet? Are you going through hospitals? Are you going to clinics? Are you going to health institutions? Is this a wellness thing? Are you working with the gyms? Are you working with fitness centers or whatever? What is your go-to strategy for getting things in the hand of people? And the time to market changes a lot when you go from public space to private space. It changes a lot because the public hospital are basically interested in not changing anything, because if you're changing anything, you make life hard on people that works there. So they usually don't want to change anything. And those that do are just exploring. They usually don't have a budget, and they usually don't have the management back up to do anything seriously. So you probably will try to find someone public to do a pilot, because they can do that. And when you want to go to the market to have proof of value and proof of client and proof of business, you probably want to go to someone where the processing time is faster. And in the private markets, I find that people are more interested in making money, and therefore the time to market the turnaround is faster than that. One way of doing this is getting a partner or distributor in the market that already have clients in the healthcare space, private or public. If they have a market and they have clients, and they can see an interest in expanding their business by white labeling whatever you are doing or providing, or can be a distributor or a reseller for your device, they already have the mechanism and the structure in place to get things in the hands of clients, and that will boost your time to market immensely. If you want to do things yourself, you have to take care to allocate a lot of funding for the sales organization in whatever market you go to, and you have to replicate that for each market, which may be what you want to go, but that's a different, it's called a completely different cost structure implementation strategy. So take care that you choose wisely, because you have probably not as much money as you want, so spend it on things that really matter. And of course, I wouldn't need to say this, the revenue potential. Some people get excited about your product, and it's really easy to say, oh, fantastic, these guys really love it, so let's go with these guys. But if there's not really any revenue potential to the clients, then it can only be, and this is probably a golden rule, it's only if you really get something very important out of this engagement that you should continue with it. So if you don't have proof of value, if you don't have clinical trial, and this guy will provide it, even though the revenue potential is not there, you could probably do that and explain it and get away with it. But if you do anything besides a pilot project and the revenue potential is small because it's a small clinic or small hospital, it either has to be a stepping stone on the way to something bigger, or a proof of value or something else. But if it's a play for market, play for revenue, make sure that you go with the clients that actually have the potential. So find an insurance company that has a lot of clients, and try to see if you can get them on board, and spend some time working out the prototype and the business, the value proposition, and delivering it, and then try to see if you can make them scale up. You probably won't get commitment to scale up from the beginning, but as soon as you can start talking about it, you should. And of course, the competition is important. Find out who are you up against. And you may consider that you are not competing directly with other products because you think they're different from yours, and that your value proposition is different from what they provide. But you have to take care to see this from the other side of the table, because the ones looking outside in on your product, they may see it differently, and they may perceive your product as being similar to someone else's product, even though it's not. So competition is not what you think, but what the clients think that you're competing against. So try to get a feel for how their perception of your offering is, because this is the one that gonna qualify you to any kind of beauty contest or not. If you can affect and influence any kind of purchasing or procurement process or institution, you should always advise them to try out 2 or 3 different products and projects, including yours, to get a real life experience about what works and what doesn't, and then have a live value evaluation of the products. Because if your product is as good as you think, you're going to win the beauty contest. But having people trying it out instead of just trying to define qualifications and features, it's much better strategy. So if you can influence anyone in that way, do it. So other indicators for the market you want to go to is if you have someone there already, it makes things easy. If you know the director, if your son-in-law, brother-in-law, or best friend's girlfriend or whatever is director of a healthcare institution, yeah, that's a good way to go, because network is God. And if they're there, they may not be the best market, but if it's already there, it's within grasping reach, and you should definitely go for it. And yeah, so I could definitely recommend that. But that's the only reason you should go to a suboptimal market, is because it's fast for you because you have network there already. There can be cultural challenges you need to take into account. So try to see if you can get through that, and also political challenges. But always look at the VCs and find out, or what the investors find. So what does my investor think would be a good market? Because if they have some opinion about that, may not be qualified at all, but if they have an opinion, well, the money always counts to someone. And if you can say that, well, we went here because this is what you said, then that's okay. So if you fail, you can always blame it on the VC, or you can use that to build a case to convince them not to go there. But still, you need to listen a little bit to what they say. You don't want to listen too much to the VCs, but here you should definitely listen to them. So on the VCs, and now this is very, very hard on the device. I hope you are still with me and not sleeping. There are a lot of different investors you can have looking at. You will have the angel investors, the VCs, the cheating investors, and friends and family. And I think, from my point of view, I've tried a lot of these guys out, and what I find is that if you can, the best thing you can do is to find people that has business goals that are matching your own. So if their business has success, if your business has a success, then that would be a great investor to have. And I will call that a strategic investor. So if they have a business and that business will be boosted and strengthened by your business being successful, then that would be the reason that they would invest in you, and they will have a two-sided incentive for your business to succeed. One is that they had invested in you and they want to see the value increase, but also that your business will make their business look better. If you can find any such investor, that would be the best one, because they have knowledge about the market and they bring network to the company, and they're not looking for a 100x exit in a couple of years like the VCs does. But most importantly, I think they know what you're doing and they understand what you're doing. Otherwise, they wouldn't consider it good for their business. That's extremely important, because the VCs definitely do not understand what you're doing. And the VCs have 50 other companies in their portfolio that they're also betting on without knowing anything about what they do. And the VCs do not know your business. The VCs do not know how to find their own backside with both hands on a good Sunday with a user manual. They can't. They do not know your business. They present themselves as very serious businessmen, yada, 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 but they do not know your business. They never will. That's not their business. Their business is to make you profitable. And they just do that by applying pressure. So strategic investors are definitely a way to go. You probably won't be able to avoid VCs at some point, but I will advise you to be aware that VCs are not your friends. They are there, they have money and they can fund you, but most likely they will underfund you. Expect a hockey stick business plan. And after a couple of years where you burned out the investments, they will make sure that you burn the invested money fast. So you will need a new investment, because that's what they do. And then shortly thereafter, you will see success, but that's fine. You require capital for growth. And then at that point, you probably lose control of the company. So this is their play, and they are completely cynical about it. They don't tell you this because it's something that you are supposed to know. So they are not necessarily your friends. They are there to make tons of money, and they are very good at it. And if they can gain control of the company, they will have control of your operational matters, and that's where things start going really bad. If your product and your business plan is good, it may be fantastic for all of you, but they will not be your friends, and they will try to push money into your throat that you don't really need and make you burn it, so you need more, because that's basically the way they dilute your ownership and get more money into the VCs, and they are all about making money, trust me. So having a strategy and go-to-market strategy, this is something that I have. Oh, there's something wrong with the slide here. So going to the market is something that I have my strong opinions about this, and I consider go-to-market's plan to be a bloody waste of time. So the go-to-market plan is basically a strategy, something you make because you are trying to tell people who know nothing a little bit about what this is all about. So basically, you need the go-to-market strategy to give it to investors that basically haven't understood your business, so they have some glimmer understanding of what you're doing and can have a look at that. So what you can use it for is to try to stake it out, like the business model canvas. Try to stake out your goals and your milestones. I'll remove the image from the presentation, send it again. Make sure that you look into this as a milestone checklist. So try to put some milestones there and try to follow up on them. So use it as a project management tool or sales management tool or process management tool or progress management tool for yourself to see, okay, this is where I want to go. And I have this goal. This is my vision. I want to have a pipeline that gives me this amount of business in 3 years. So in order for having this amount of business 3 years, over the next 12 months, I'm going to need this much business, this much in my pipeline. I want to have these potential clients. I need to have 200 potential clients and 20 actual clients by the end of the year or by 12 months from now. So this will be a very good exercise to have a realistic plan for what does it take, what kind of progress do I need to see to realize the growth that I have, the promise myself and my investors that I'm going to have, and put that in the go-to-market strategy. So the go-to-market strategy is a lot of fluff and words and statements and proof and all kinds of crap that's a totally waste of time for most people and other than your investors. Because basically what you have out of this is the goals and the milestones. Use it for yourself to build a credible project plan for what you want to see in the results of the business before you can say it's a success or not. And this needs you to be working diligently on following up. You need to have monthly goals, you need to have milestones, and you need to follow up strictly on those. And the board of directors you have and your investors probably like this because they want to see this progress. And so at the end of the day, when the go-to-market strategy is over, everybody forgets it. But what remains in focus is what are the goals, what kind of milestones, how many clients, how big pipeline, how big in revenue can I expect, and what is my tracking on that revenue realization. Those are the things that remain after the go-to-market strategy. And that's why the most important part of the go-to-market strategy is building that project plan for the milestones and projects. And also check out all the time, be honest with yourself and see, okay, how is this progressing? Do I get the influx? Do I get the clients in the pipeline that I need? Do I get the sign up to the contracts? Do I get the progress? And if you don't, then you need to adjust your go-to-market strategy, which is, well, don't adjust your go-to-market strategy, adjust the way that you actually operate in the market. Invest more heavily in sales processes, use more resources on LinkedIn or lead acquisition, or go to more conferences, or hire a external outbound company that can do sales for you and try to set them up and say, okay, if I give you 50,000 euros, what are you going to give me? They're going to say, oh, we're going to give you 20 leads a week or something like that. That can help. It can boost your ability to put into the pipeline. You are not alone. So worry about showing the progress and finding the tools to get that progress in the books. And don't believe you are the only guy in the world that has to work on this. But you can go to investors and say, I need more money for the sales organization or the marketing. And that's a good pitch. If you can show the numbers that you're not progressing as they need, that's a good way to get more money into that particular effort and using it for what you need. So basically, you have a go-to-market strategy because you have morons on your board and among your VCs that don't understand anything what you do. So that's what I have seen with my go-to-market strategy. It was basically a piece of educational paper that I spent months trying to write because the guys on the other end actually didn't really care and just needed an excuse to do whatever they need to do. So I'm a bit cynical about that, but the upside is that you can use it for yourself to build the milestone and goals and get that going. But once you are started, you probably won't ever need it again. So from my point of view, it's a little bit of exercise in futility. But of course, again, if you have VC support, you probably need it because otherwise they won't get it. Okay, so let's go to the business engagement type. So what kind of stuff can we do with the business? We have, of course, the B2B2C, the B2B and the B2C, which is gibberish. So you either have the opportunity to sell to someone who are already in the market and can resell your stuff to the real clients that are going to pay for it, which is the B2B2C, or you can sell your stuff to other businesses because they need it for whichever purpose they have, which is a B2B, or you can go directly to the clients and sell your blood pressure device directly to end user consumers in the market, where you can use a portal, a web portal, or an internet shop, or Amazon directly to clients. So obviously in the B2B area, you have an upside because it's scalable. It's a limited investment in sales because you basically just need to find the distributors. It's a partnering setup, and you can have sales agents on commission, and you can do white label. So these are upsides because all of these are revenue triggers. They are scalable revenue triggers, and they will enable you to go through other organizations faster. So the downside of B2B and the B2B2C is that you don't necessarily get to see what kind of pipeline your distributor has. And that's really a bitch, because when your investors are asking you to present your pipeline, and nobody can say, yeah, but I'm working together with Microsoft and they won't tell me what kind of pipeline they have. That's a problem. So when you do your partnering with these guys, try to make them commit to a regular reporting interval about what they really have, what they're doing, and what they have, and be a part of their sales team if you can manage it, to get a feel for what kind of clients they have, what kind of pipeline they have, so you can make your own forecast. But forecasts from distributors are really hard because you're depending on external sales team that you don't control. You also don't get feedback from the end users. They filter back to you through the partner, so at some point it can be difficult to know what's really going on, and of course you need to educate them. In the ISO worlds, there is actually also regulatory demands for distributors. There are certain documents in the policy management system that they are required to need in order to be legally able to represent you if you have an ISO certified product. So you need to educate them in any case, so might as well get it right. And you probably can't control the end quality towards the end user, because if there is a distributor in over it, if they are not good enough, or if they are sloppy, the end users may experience a bad product or bad process, which can be difficult for you to control. So those are the downsides of B2B, but I think, yeah, let's do the B2C first. The B2C upside is, of course, that you have direct access.
Henrik, can I make a question?
Yeah, sure.
Yeah, I'm just saying. Yeah, that is my difficulty, in fact, that is to try to understand how I can stay in B2B2C upside and not going fast to B2B2C downsides. Because in fact, we can find distributor and partnering outside. We all have this experience. Microsoft is a great example, right? But in fact, it's hard to stay there in upside. So can you give me some examples that how we could try to engage these partners and distributors to be in that part?
Yeah, I can. I've been working with B2B a lot of times. But let's take it on the discussion and take it later on, and maybe we can dive deep into it in individual sessions, but I'll be happy to discuss this further.
Okay, thank you.
So on the B2C upside, you have direct access to the client feedback. This is both a blessing and a curse, because you get more direct input to your product improvement, and this is very good and operational. You get control of the client process, you get the pilot forecaster clear, you got control of costing, and the marketing of brand is yours, you can control it. So there is definite upsides to that. And the downside, of course, that it requires you to be everywhere and have a huge sales organization. So basically what your investors tell you is that you should make sure that you have the upsides of both the B2B, the B2B2C, and the B2C. So they will expect you to be able to have the entire left side of this slide. They will expect you to have full total control, which of course you can't, because you have to make a choice. So one of the things that I have done is to put into the contract that we need to have monthly or at least or maybe bi-weekly engagement. I have also set up a support line where I can do second level and third level support, and it means that some of the client issues that comes from the end user clients filter back to me on the support, and that means that I do get some feedback from the clients. But it is not an easy job, and it takes some education, and especially it also needs you to be able to say when your B2B client is right and when they're wrong. And there's no value in having Amazon as a B2B client or B2B2C clients, because they're so big that your product is insignificant. So you need to find a balance where your product has a strategic importance for them, and them having a client's portfolio that is significantly good to give you some kind of growth and some kind of revenue. But just to take the Microsoft example, you will drown because they have so many B2B partners that you just become an entry in the list somewhere. And basically your own responsibility to create a market, because Microsoft sure as hell doesn't do it. So you need to find a B2B partner that is big enough to have clients and small enough to consider that it's important to make a strategic effort to sell your product to increase their business. So you'll have a more intimate discussion with the salespeople in that organization. So it's kind of like a balance. Find someone that are big, but don't start with the biggest one, because they don't really give a damn, because they have so much stuff going on. And then like the Microsoft and Azure, well, I've tried that. It's all about being able to put you on the list of people that does things in Azure. That's the most important thing for these guys. They don't care if you make business or not, as long as your name is registered on the page of companies that does the Azure business. So it's a balance, of course. Everything is a balance. But from my point of view, my recommendation is don't try to go big initially. Try to get traction, try to get revenue, try to get distribution, try to get results from a mid-range B2B partner, where you have a more urgency from their side to make business, which means you have a closer dialogue and you can better motivate them to be part of this. Also, big organizations have a tendency to change people with 18-month intervals. Your account manager is going to go somewhere else, and you're back to basic and start from scratch by building up a new relationship. It's better not to have big businesses as your partners for the beginning. And trust me, if your business grows enough, at some point they will come knocking on the door. And when it does, then it's time to cash out. So don't try to go big from the beginning, because it is a waste of time. So business models. And this is actually the slide that everybody's been waiting for, because this is the entire session today. So what am I going to do about business model? Well, my first advice is to be creative. There's no such thing as a standardized business model. You can think there is, but depending on the product and the value proposition, there's always a lot of creativity available for you. So you think the business model, but it's a plan, but you already have it. So you have a plan, and the thing you need to realize is that any plan will not survive contact with reality. And this is your first rule of the order here. You have to know that when you start with a business model and you start to realizing your business model plans, the first thing that will happen is that doesn't work. And the thing that you shouldn't do is go into panic, because this is normal. So try to find out what is it that does not work, and how can I change that, and how can I turn it into something that works, and then try that. And then try something else, because every time you try a new client, then the plan you had before may not work, because it's different. They have a different clientele, or they have a different distribution, or they have a different reimbursement, and something is off in the business model. So don't put it on your webpage, don't put it on website, don't put it in your presentations, or you can put it in presentation, but make sure that people know that this is a work in progress. And you may have different business models for each different clients. That's not unusual, but please have an open mind. Use the quality survey, use it, review it, learn from what doesn't work, change it, and re-implement it again, and do that. And don't stop doing it, because markets change, people change. And yeah, you can use the business model canvas to map out different models, but the business model canvas does not solve your problems. It's just a tool, and tools are very good at doing things when you know what you're doing. So if you know what you're doing, the business model canvas can be a good tool, just as anything else can be a good tool, but it is still just a tool, and tools do not solve problems. People solve problems. So going through the business modeling and the sales process and have this plan. But if you have tools you're really good at, then use it, because the business model canvas is a good tool if you're very, very good at using a business model canvas. If you're new to business model canvas, it doesn't really work, because it's just It's just a tool you're not experienced with. So in all your business things, rely on tools you're very good at and know how to do, because this is going to be your best assets. But in the business modeling and going to the market here, be creative. And like you see on this on slide here, the innovation potential in the business modeling is huge. So when you do like a standard software as a service, you do a standard product and you sell it as a unit price, there is always some creative way of putting this in the hands of people that will make it work better than before. So one of these things, which is now more or less established in the business, is if you're building a hardware medical device, let's say you build a patch they put on the thorax to measure heart rate and record ECGs and what have you not. This device costs maybe, I don't know, $800 to produce. So it's kind of costly because you're going to sell it for maybe $2,000, I don't know. So the unit price is high, and that is a barrier, because who the hell is going to buy 500,000 of these guys? Because that's a huge load of cash. So they're not. And that means that you have difficulty selling it. And on the top of that, you have a VC selling it. You need to sell at least batches of 500. If you cannot sell batches of 500, you have to decline the clients, because then it's not good enough. And then you're left with no clients and no money. So what do? So you do this, you say, okay, so how do I get this into accessibility range for my clients? And you do that by engaging with the leasing partner and say, okay, they will not buy this stuff, they will lease it. And you will lease it for a very, very small amount. And the leasing contract will be like 24 months or 36 months. And during that period, the monthly cost for the device will be much more reasonable. And since this is now not a procurement, but a running cost for any healthcare institution, it's much more easier to get into the budget. So that's innovation for you. And it's really, really cool, because it takes away a huge barrier, which is buying stuff and owning stuff, and remove that pain by saying, I'm just renting it. It's not my problem. I'm just paying for having it. So it's not my problem. So if it breaks, well, it's not my problem. The not my problem strategy is probably one of the greatest that ever were, because anyone in the healthcare, in any public space, they don't want problems. So if you can make it into an SCP, which means somebody else's problem, that is your way to go. A lot of, if not all of business model innovations is based on the SCP strategy. Make it someone else's problem or take away their problems. Another great business model is in my business in the space of remote patient monitoring, virtual care. One of the biggest issues is getting the hospitals and the health institutions to adapt to doing virtual care when they in fact are not geared to that. The doctors are conservative, the hospitals conservative, the nurses are conservative. Everybody wants to be as they usually were. And having now a virtual team that does healthcare without seeing people, that's just weird. So it meets a lot of resistance. And since all business is relying on organizational change for the 80% part of the business and only 20% technology, the 80% of organizational change is out of your control. You can't even do it. You can just provide the technology of the 20% that works and then hope to hell that the hospital is going to do the organizational change and cover the rest of the 80%. But the fact of the matter is, most likely they won't do it because they really don't want to change. You know, this old crack about who wants change? Yeah, everybody wants change. Who wants to change? No, nobody wants to change, especially not in hospital. So what happens is this. A guy I know that creates a business and he goes to the hospital and say, hey, I'm registered as a virtual hospital. I can do remote patient monitoring. I have the system. I have the nurses. I have the doctors. I have the licenses. Why don't you pay me 3,000 euros a day and I will take your patients off your hands and you can just forget about him because I have him in my care and I'll sign to that. And if he goes bad, I'll send him back into you guys. It basically means that the hospital, they can now put some money in the hands of someone who does the virtual care, solve the problem of too few hospital beds by just giving someone money and then shoving the patient out the door because someone will catch him before he falls and put him into his home with slap a thorax patch on his chest, and everybody's happy. Now that is creative business modeling, because this is the guy that takes away the problem for the hospital without the hospital having to do anything. And that's the best kind of troubleshooting ever seen. Okay, so be creative, and well, there's always some smart way of doing stuff that you haven't really thought about, so talk about it with your colleagues. Okay, on the revenue side, you want to make sure that you have your revenue streams in place and plan for that. And there's a number of different revenue types you can consider. On the recurring revenue side, you can do the application, you know, that you provide apps access to service, so you can charge for a subscription for the application, or it can be a one-shot buy, or it can be free, whatever. But this is an opportunity. You can do the operation and hosting, charge monthly for the hosting and maintaining the software and the service, even though that this is something that you will consider to be a natural thing. If you have 200 clients, then suddenly the operation and hosting charge will be significant. And I would very, very heartily encourage you to do automation on your hosting and deployment stuff, because that's going to kill you if you don't. But definitely charge for the hosting, because nobody is cheap. If you deploy it on Amazon, it's definitely not cheap. If you do it on-prem, you should still have a fee for that, because you still need to maintain the software and it still takes money and time. So have that hosting operation charge fixed in place, no matter where you deploy. Charge for services. You should probably do a lot of services like reporting, upgrading, bespoke implementation, configurations. Every time someone wants you to do something that is outside the box, you need to charge for it. Otherwise, you may find that you are being bled to death with 1,000 small cuts, where you do stuff here and there that cost resources and money that you don't get paid for. So services that cost money is a behavioral change, a behavioral effort that makes sure that your clients will behave, because if they pay for the services, they will only ask for the services when they need it. If you don't pay for the services, then you ask for it all the time and more of it, because everything that's free gets sucked up. So don't have anything that's free unless it's support. You need to be supported, and like error support, bug support. But any support outside of this is something you charge. And I will probably recommend that you for support charge a monthly fixed allotment for support to get some kind of commitment to support, so you can calculate on and get some money in to cover the cost of your supporters, because it can be quite steep, especially in the contract part. So make a contract, make sure you have a mandatory support cost for the first 3 months of the installation and the engagement. You can call it hypercare, which sounds great, and can give you an excuse to charge some money upfront for support in the beginning of the contract, because you will have more support in the beginning of the contract no matter what. And then consider you have any value-added services that you can put in outside or on top or besides your products that can give you a increased value and give you an opportunity to charge more money. Other revenue, which is like one-time or one-shot things like app downloads, charge for that. You have that. You can charge it, but it's in the Apple and especially in the Apple Store, but also in the Google Play, it can be complicated to have a charge for that, because it becomes a barrier. Those things, do I really have to do that? Depending on what your product is, it may not make sense. But in the long run, I would always prefer and prioritize recurring revenue over single shot revenue. But it can have advantages, especially if you are strict for cash and you want to do feature development. You can always go to the client and say, yeah, if you want to have this change, you need to pay for it, because we have so many things to do and we can only prioritize the stuff that is being paid. So you have to pay for this change, and also note that I will retain the IP after the change, because it's my product. If the client needs to change bad enough, he will pay. Trust me, I've seen it, I've done it, been there. It works. And you can also use this to do product expansion by pitching expansion packages and changes to the product to clients, and have them financing it because they consider it to be strategically important. And everybody really liked the idea about contributing to a product that expands by having a lot of different clients contributing to the expansion of the product. So some will try to retain IP for whatever they pay for, but you should definitely reject that. Really, really insistently, any IP should be yours, but you can have clients and organizations develop your product and drive the development by asking them to finance changes that they feel is important. It works. All right, so pricing, international market is always a bitch, because how much do you pay for your McDonald's burger? You know that it's the most important or the most expensive McDonald's burger in the world can be bought in Norway. The cheapest one probably somewhere in Asia, India, I guess. It's probably not the same quality in all countries, but the prices is definitely independent of what is in the burger and what it costs to bring the burger to the client. So value-based pricing. If you have absolute pricing, you're gonna this is calibrated for the Western European market, you're gonna lose everybody in Asia. If you price it for the Middle East, you're gonna lose everybody in Europe. So you need to make sure that you have a value-based pricing, and you also need to factor in the cost of acquiring the client and the cost of delivering the product in that market, of course. But just everything aside, looking only at the pricing and the ability to purchase stuff. I've put in the link in here what I use often, where I try to calculate the price and say, okay, well, what does it cost to buy stuff? And you know, in Germany and in Greece, there's a huge difference in the purchasing power of people, even though they have the same currency, because of the country's different income level. The purchasing power is hugely different. So in this case, the index for the pricing in Greece would be 38, and the bond in Germany, in bond, it would be 88. This means that, for instance, a cinema ticket for a high-end cinema will cost comparatively more in Germany than it would in Greece for the same product. So if you want to make sure that your prices is not becoming a barrier in a country where you may have big volume, you need to adjust the price to be at a level where the local purchasing power can actually make this attractive and realistic to be bought and buy and used in this market. So it is tempting to say I just have one price, the same price everywhere, but this may just rule you out of a number of markets because it is not available for people because their buying power is simply not good enough. So what I always do is I say I want my monthly subscription fee to be the same as a cinema ticket. If it's a 10 euro ticket, then well, most people can afford it. But 10 euros in Europe for a cinema ticket is acceptable, but 10 euros in India for a cinema ticket is totally out of this world, and it's not going to do anything. So find a price that is reasonable, and the way you can argue this is if the price is low, it's maybe qualified by having a bigger volume factor. Like in India, the potential volume is staggering. So having a low cost there is probably good enough. And you should also, you should also consider the fact that besides the actual purchasing power, you probably also need to have, besides the actual, the qualified price per market, you also have some kind of step down ladder. So if they buy 2 devices, this is the cost. If they buy 2,000 devices, this is the cost. And buy 200,000 devices, then its cost is much lower. So you have this kind of step down ladder. People expect volume discount. Everybody does, and it's fair enough. And you always just want them to go to high volume. And what I will recommend is that you have an engagement for the clients is qualified by them having a budget and committing to a minimum amount of revenue up front for you. So in my business, I say, if you do not want to engage and buy a system or implementation for, let's say, 500 end users initially for the first commitment, if you don't want to commit to that, then you're not serious, and then I'm not gonna work for you guys. So if they come to me and say, hey, I would like to buy the system, what does it cost to have a remote-based monitoring for, let's say, 3 users? They're wasting everybody's time because they basically don't have money, they don't have budget, they don't have stakeholder engagement, they don't have anything. So if they are not budgeted and committed to buying a significant amount of stuff up front, then you should not spend any time with these guys. Yeah, that was actually quite important. So let's stop with that one and let's go to questions. Okay. Anybody who's not sleeping, you can now ask questions. They're all sleeping.
I have stopped the recording, so your questions will not be recorded or shared.